Hey guys, let's welcome to Pathology Insights. Let's start with a very important topic, that is workup of low grade B cell lymphomas. This is basically a practical approach how to go to a diagnosis of a particular non-Hodgkin lymphoma. Okay, so let's start. First, for these are basically non-Hodgkin lymphomas. Okay, so first we do CD3. CD3 is a marker of T cell. Okay, T for 3. Okay, so CD3 is a marker of T cell, so it should be negative because we are talking about B cell lymphomas. Okay, so one B cell marker should be there, so CD20 should be positive. Okay, so it is not a T cell, it is a B cell. Simple. Okay, after this we do a panel called CD5 and CD10 panel. Okay, CD5 positive, CD10 negative. So what it should be? Then we'll look for CD23. It can be positive, it can be negative. Okay. So if it is positive, then we call it CLL or SLL, chronic lymphocytic leukemia or small lymphocytic lymphoma. Okay. If it is negative, it is basically MCL, mantle cell lymphoma. Next option we have CD5, CD10. Both CD5 is negative, CD10 is positive. Okay, so what is the possibility? Only one possibility is here, that is FL, follicular lymphoma. Simple and easy to learn, follicular lymphoma. Then last option we have CD5, CD10. Both are negative. Then we look for mid 88 mutation. If it is positive, then it is basically LPL, lymphoplasmacytic lymphoma. If it is negative, then we look for loss of TCL or many more are there. Then we can think of marginal zone lymphoma. Simple. So this is a workup for the low grade B cell lymphomas. Okay, CD5 and CD10 panel we do. Simple. This is a practical approach how to go to a particular diagnosis after histomorphology. So this is being asked in theory as well as in practicals. So keep that in mind. Thank you.